All right, good evening, everyone. I hope you are doing well. Thank you for tuning in to tonight's webinar on the link between cancer and heart disease in recognition of Heart Health Month. We're hosting this webinar in collaboration with the Center for the Prevention of Cardiovascular Disease. And I just wanted to thank them for partnering with us on this lecture and for all of their help. It's always a pleasure working with them. And before we get started, I just wanted to share some ways you can keep in touch with us. If you see this slide, I've listed some resources for you for Perlmutter Cancer Center. There's the information for our website, our email address. We just launched a Twitter account, which we're very excited about. So please follow us. And we also have a Facebook page where we post news and events all the time. And I've also listed the resources for the Center for the Prevention of Cardiovascular Disease. They do wonderful events all throughout the year on different topics related to heart disease. And I encourage you to go to their website, check out their upcoming lectures. They do amazing work. And they also have a Twitter page, which you can follow as well. And finally, we are going to take questions at the end of the webinar. So if you have any questions for Stephanie, you're going to see a Q&A box on the top of your screen. Please type in any questions that you have, and we will take questions at the end of the program. And with that being said, I would like to turn the program over to our speaker for tonight, Stephanie Hopkins, who is a nurse practitioner in the Center for the Prevention of Cardiovascular Disease. And we're very excited to have her with us tonight. Let me see, Stephanie, I'm going to stop sharing my screen.
Okay, can you see my slides?
Yes, your slides are up. They look great.
Okay, all right, wonderful. Okay, everyone. I hope my audio is okay. I hope everyone can hear me all right.
Yes, it sounds good.
All right, wonderful. Okay, so good evening, everyone. My name is Stephanie. I am the nurse practitioner for the Prevention Center of Cardiovascular Disease at NYU. And I'm going to be talking to you this evening about preventive cardio-oncology and some of the treatment modalities that we've put into play for this new clinic that we've started at NYU. And just before we start discussing all of that, I'd like to take a minute just to reiterate some of what Rachel has said about our center, but just to give you a little bit more background information about our prevention center. So our prevention center was started about 20 years ago at this point. And the team first started with 4 cardiologists, Dr. Schwartzbard, Weintraub, Dr. Fisher, and the late Dr. Michael Schloss. And these 4 cardiologists started the prevention center at NYU, and we've now grown to a team of 12 physicians. We even have primarily our physicians are here in Manhattan, but we also have one physician that's now out and based in Long Island, Dr. William Blau. He's one of our newest attendings to our program. We have one nurse practitioner, and that's me. We have a nurse, a registered dietitian. We have a robust research team, and then we have our 2 wonderful administrators that we would not be able to have any of this be possible without them, both Anya Coates and Julia Levine. They're our administrators for the program. So there's just some information about us, and there's our address and our phone number in case you should have any questions or interested in making an appointment with one of our physicians. That's our contact information that's there. Okay. And now I think that it's important for us to first discuss what is cardiovascular disease. Before we talk about breast cancer and our treatments and how they can influence cardiac disease, I think that it's important that we take some time and we discuss cardiovascular disease itself and the disease process. So the term cardiovascular disease is also known as heart disease. And you can think of this as an umbrella term. It includes numerous conditions, but many of them are related to a disease process called atherosclerosis. So you can see in that picture there, this is a cartoon illustration of what this disease would look like inside an artery. So atherosclerosis is a condition that develops when a substance called plaque builds in the walls of the artery. This buildup narrows the artery, making the space for blood to flow very narrow. You can see in that picture there that blood and its particles are being squeezed through that tiny space. This unfortunately can lead to blockages, and that's the clinical scenario when patients unfortunately have heart attacks. Another name for a heart attack is called a myocardial infarction or a stroke, and the stroke carries a few names. They refer to them as a small stroke, which is a TIA, or another term for it is a cerebral vascular incident, and these are all going back to the same disease process, which is known as atherosclerosis. Another extremely important aspect of this talk is really going back and reviewing and remembering the signs and symptoms of both heart attack and stroke. This is extremely important, and both of these pictures here are from the Go Red for Women campaign, reminding us that as women, we do experience heart events differently than men in some clinical scenarios. So the symptoms that we all should be concerning ourselves with is an uncomfortable pressure in the chest, squeezing, a sensation of fullness, pain in the center that lasts more than a few minutes, and sometimes it can go away and then resurface. This pain or discomfort can happen in both of your arms. It can also occur in the back, the neck, the jaw, and even your stomach. You can also have shortness of breath without chest discomfort, which is very important. And other signs could be breaking into a cold sweat. You can be nauseous, become lightheaded. And as with men, women, our most common heart attack symptom is chest pain. So don't forget that. You can, as a female, have chest pain and be having a heart attack. And then also conversely, you cannot have chest pain, but experience one of those other symptoms that's listed there. Even have symptoms like shortness of breath, nausea, and vomiting. That could also mean that you're having a heart attack. So once again, extremely important. If you have any of these symptoms, please seek emergency treatment and make sure that you're not brushing this off and saying that you'll do it at another time. It's extremely important that you recognize these and you act quickly. On the right-hand side there's some signs and symptoms of a stroke, and same goes for those. We can look at these and know very quickly that something is wrong with someone. So this would be numbness and weakness in your face, your arm or leg, especially one side of the body. So if you do notice any of these symptoms with you or your loved ones, please call 911 and seek emergency medical treatment. Okay, so now let's discuss heart disease, women, and breast cancer. So unfortunately, heart disease is the leading cause of death for women in the United States. It actually is the cause for 1 in 3 deaths every year. Cardiovascular disease kills more women than all forms of cancer combined. And yet only 44% of women recognize that cardiovascular disease is their greatest health threat. Heart disease can sometimes be can be a complication of breast cancer treatment. Older women who survive breast cancer are more likely to die of heart disease than cancer reoccurrence. I think this is, these statistics are profound. I think that not many of us realize that as women, the #1 cause of death is in fact heart disease. And there's about a 10-fold increase of risk of dying from heart disease rather than breast cancer. And this, of course, is not to diminish the risk that breast cancer poses to both women and men, but also reminding us how important early detection of cardiovascular disease is. And to start and to really start to dive into cardiac disease and how we care for our patients, we first have to talk about some of the risk factors for heart disease. So I'd like to start by showing you this American Heart Association graphic that talks about life's simple 7. So these are this group of 7 conditions that we're going to discuss are really the core of primary prevention of cardiac disease. But a lot of this is, we're going to see soon that a lot of this overlaps with cancer treatment and cancer outcomes. So some of the things that we're going to discuss are going to be cholesterol, diabetes, high blood pressure, physical activity, smoking, weight management, and diet. It's estimated that many Americans roughly about 47% have either high blood pressure, high cholesterol, and they suffer from one of these risk factors. So given what we know about these risk factors, our prevention center started this program to really intervene as early as possible. So in our preventive cardiology clinic, we are focusing on these risk factors from first day of diagnosis. And we believe so strongly that early disease detection and prevention not only improves overall health, but we're learning that it is significantly improving cancer outcomes. And part of this reason is that as we age, we know, we've just learned from the previous slide, that many women are dying of heart disease rather than cancer reoccurrence or from the breast cancer itself. So it's extremely important that we focus on these primary risk factors of heart disease. That way we can prevent heart disease later in life and often mitigate the complications that may come with certain medications that are being used in breast cancer treatment. Okay, so now on this slide here, we see some of the risk factors for cardiovascular disease. So that's there on the left. So diabetes, hypertension, and some of the risk factors that we're going to talk about in a few minutes. But you can also see that there's a significant amount of overlap between the risk factors for both cardiovascular disease and breast cancer. So on the middle section there, you'll see age, diet, family history, alcohol intake, hormone replacement therapy, having obesity or being overweight, physical activity, and tobacco use. So all of these are risk factors of both cardiovascular disease and breast cancer. And of course, some of these are not modifiable, but what I'd like to focus on are the things that we can change and things that we can do to improve. So this would be what your physical activity status is, your nutrition habits, and what your blood pressure is, what your cholesterol is. All of these things can be changed and improved and increase and improve outcomes as we are moving forward in our treatment. And then you can see on the right side of the screen, there are several things that are listed there, several risk factors rather, that increase both the risk of cardiovascular disease and breast cancer. So nutrition habits. Following a healthy diet, you can see that it decreases both the risk of cardiovascular disease and breast cancer, but unfortunately, following a Western style diet increases both risk of cardiovascular disease and breast cancer. We know that if you have a light, and this should say only light alcohol intake, it can be beneficial for cardiovascular disease. But I remind you, as women, we are allowed one alcoholic drink. And also, as it pertains to cancer, there is no beneficial data that has been seen with alcohol consumption. So that one there is, you can see that there's an inverse relationship there, but I strongly suggest that alcohol be limited. And then the other things that are listed here that you could read through: red and processed meat. Physical activity is a very important one. We know that if you're physically active, this is both going to decrease your risk of heart disease and breast cancer as we age. Smoking, early menarche, early menopause, and hormone replacement therapy are also some of the things that we're going to discuss. Okay, so some of the information that we know so far about breast cancer treatment and heart health. We know that our cancer outcomes are influenced by our cardiovascular disease health. So this means that if you go into we start your cancer treatment with high blood pressure, or diabetes or high cholesterol, we know that the outcomes for your care may potentially be worse because you have these other comorbidities. So we're really trying, again, to focus on fixing things like high blood pressure and making sure that we're treating this early on. And the other thing that's extremely important is that women that already have established cardiovascular disease need to be even more diligent with their prevention strategies. And this would be preventing a second event. The chart that's listed there on the right has some of the medications that are commonly used for breast cancer treatment, and then all of the potential cardiac side effects that they can cause. Now, we won't go into all of these in great detail tonight, but all of these medications and all of their potential cardiac side effects are of course, risk factors that we identify in the clinic, and then we follow our patients as they're moving through their care and looking for decrease in heart function, increases in blood pressure, increases in cholesterol. That way we can intervene as soon as possible to fix these. Okay, so our first extremely important topic for the cardio oncology is going to be good blood pressure control. So having high blood pressure or hypertension increases risk for cardiovascular disease. And it's important to understand what causes high blood pressure. So high blood pressure usually develops over time. It can happen because of unhealthy lifestyle choices, such as not getting enough regular physical activity. Certain health conditions like diabetes and having obesity can also increase your risk for developing high blood pressure. And high blood pressure can also happen during pregnancy. There is emerging data that our OBGYN history is extremely important for our cardiac disease potential as we age. We're learning that if you have gestational hypertension or gestational diabetes, this can increase your risk for cardiovascular disease later in life. And we are trying to include this in all of our preventive cardiology exams to really develop a full risk stratification for each one of our patients. So it's important to remember that a normal blood pressure is less than 120/80. And a number greater than that is considered to be abnormal. So close follow-up with your primary care doctor is essential. If you have a cardiologist, this should be something that you're discussing at each visit, making sure that your blood pressure is normal. Things that you can do to help reduce your blood pressure is eating well. So, and by that, I mean, we'll talk about this shortly. Watching salt in your diet is going to be extremely important as it pertains to high blood pressure. Being active, moving every day, hopefully walking about 10,000 steps each day if we can. Managing weight. Weight is a big factor in blood pressure. It's important that if you are overweight or if you're suffering from obesity, that you work with your clinicians and we work to lower body mass so we can reduce blood pressure. It's very important that you don't smoke, not only for cardiac reasons, but also for cancer risk as well. We know that smoking directly increases blood pressure. So of course, smoking should be removed as soon as possible as one of our risk factors. And sleep, last but not least, but sleep is very, very important for blood pressure and normal blood pressure readings. We know that if you sleep less than 6 hours a night, you can have higher blood pressure readings. And it also comes along with some other risk factors that we see in high stress environments for people that don't sleep well. So just to recap here for blood pressure, the big thing that we're trying to fix here is the way that blood pressure can affect the health of your heart is that you can think of it, one of our doctors often uses the analogy of high pressure, like a high pressure system in pipes. And if the pressure is high for many years, what can happen is it can start to erode the pipes, and in this case, it's the arteries, and it can start to remove some of the protective features of the artery wall. And if we start to damage that artery wall, then cholesterol is allowed to get into the vessel. And like we saw on that slide previously, the LDL cholesterol can get in there and cause a blockage. So it's extremely important that we lower the pressure, reduce the force and the friction that's against the arteries, and really helping to lower pressure and help the heart. The next slide here, I'm going to show you, I know it's got a lot going on there, but historically from our research, from our literature, we know that patients that have a lower blood pressure do better. This means that they have less heart attacks and less strokes in the long term. And we know that different medications are very beneficial for specific groups of patients. And it's been part of some of our clinical practice at the Prevention Center that we focus on medications that are specifically tailored for patients that have breast cancer, also may be at risk for heart failure. So one medication that's often given is a medicine called a beta blocker. The names that maybe are familiar to you are metoprolol or Coreg. These are two commonly prescribed beta blockers. And we are seeing that patients that are taking these medications actually have better outcomes later in life. The way that the heart is functioning is often preserved, thankfully, if a patient is on these medications. So this is, of course, something that we discuss in detail at our center. We try to gear our medications for our breast cancer patients in exactly this way, that we're always looking ahead and we're figuring out and we're thinking to ourselves, what can we do here that's the best option for our patients? If we know that they have high blood pressure and they're currently going through cancer treatment, let's give them a medicine that may prevent some of the cardiotoxic effects that they may go through in the next months to years as they go through their treatment. Another thing that's very exciting is heart failure treatment and management. Heart failure treatment and management has progressed significantly over the past couple of years. And there are several medications that are available to our heart failure patients that we're now beginning to see hopefully used in our breast cancer population if there is a slight decline in heart function. This is a really exciting medication that we have available to our patients, and we can preserve as much of their heart function as possible. So this is just an overview of some of the medicines that we might use in our clinic. So again, that would be a beta blocker to help the heart beat more effectively, or using medicines for blood pressure, like an ACE inhibitor or an angiotensin receptor blocker. Something like maybe losartan is a medicine that's commonly used. And then the newer medicines that are used in heart failure that can be used in our breast cancer patients as well. Okay, so the next prevention topic is high cholesterol or hyperlipidemia. So a very good question that I often talk to my patients a lot about, and they say, you know, Steph, what causes high cholesterol? How did I get here? How are my numbers so high? And basically your cholesterol comes from two sources. Your body makes cholesterol naturally. We need it for metabolic function and some of our hormones. And then we also get dietary cholesterol, so from the food that we eat. So those two mechanisms are how our body regulates cholesterol levels. And if by genetic predisposition, your body makes a lot of cholesterol, you will see your numbers to be higher. Then if you eat a lot of cholesterol intense food, so anything that comes from an animal is going to contain cholesterol. So if you eat a lot of animal products, you will see that your cholesterol numbers may go up. And it's very important to have these numbers checked and speak to your medical providers about what's a normal cholesterol for you. Because just because what is maybe normal for a brother, a cousin, you know, someone that you know, may not in fact be normal for you in your clinical scenario. So it's extremely important to speak to your doctor and talk to your team about your cholesterol numbers. But essentially there are, well, I guess, 3 cholesterol numbers that we really like to focus on in clinic. The first one is your LDL, and you probably know this as being your bad cholesterol. This is the number that your doctors and your team will be focused on to try to reduce. We know that having a lower level of LDL does thankfully give us a lower risk of heart disease later in life. We also know that having an adequate level of HDL is important. I will say, though, that it doesn't have the same magical or protective properties that we once thought years ago. Years ago, you may have heard your team say that, oh, your HDL is okay, then we don't have to worry about your LDL. But we're learning now and that your HDL, yes, it matters, but it doesn't negate having a very high LDL. So it's extremely important to be focusing on that number. And another player in the cholesterol space is triglycerides. So you want to make sure that your triglycerides remain normal. And for all patients, regardless of where they are in the clinical spectrum, triglycerides should be no more than 150. And for patients without known heart disease, we're looking for an LDL less than about 100. And then for our patients that do have heart disease and they've had events maybe like heart attacks and strokes, we're really looking for a very low LDL cholesterol, something less than 70. So when we have our breast cancer patients come see us in clinic, this is of course something that we discuss in great detail. It's always important to be focusing on good dietary patterns and exercise habits, just as always the foundation of good medical therapy. That should be something that every patient is trying to do to lower the numbers naturally. And then, of course, if we find that there's evidence that you need to be on cholesterol medication, may this be by if you've had a CT scan, that maybe shows some calcium within the coronary arteries, or your doctors have seen some other evidence that increases your risk of heart disease, this is definitely something that needs to be reviewed and discussed, and that way we can help you to lower your risk. The interesting thing that was recently published just last summer is that we're seeing some very exciting research with cholesterol medications called statins, and how they may be helping our breast cancer patients in more ways than one. So historically, like I mentioned to you, we know that having a low level of LDL cholesterol does give us a lower risk of heart attack and stroke later in life, which is extremely important. And the other thing that we're now seeing is that there, in certain groups of breast cancer patients, statin medications by themselves and how they react with a cancer diagnosis may actually be beneficial for our patients long term. So in this research study that you see here, the research here that was done, this was done by MD Anderson. They found that a 58% relative improvement in breast cancer specific survival and a 30% relative improvement in overall survival with statin use. So very impressive data. We know that even without the diagnosis of breast cancer, statins help our cardiac patients long term. And now it seems that this risk reduction benefit is proving to transcend to breast cancer patients. So it's really showing us that if you have high levels of cholesterol and you've had cardiac disease previously or newly diagnosed, if you've just been to your cardiologist, maintaining normal levels and reducing them is extremely important as you go through your cancer care, and then equally as important as you move into survivorship, keeping these numbers very low. That way, 10 years, 15 years, 20 years into survivorship, this is something that has always been controlled and it never causes an issue for you. Okay. The next topic that I'd like to discuss with you is diabetes. So having a high blood sugar, or then potentially maybe being diagnosed with type 2 diabetes, unfortunately increases, all diabetic patients have a higher risk of cardiac disease. And just a quick overview of what diabetes is. So when we break down food, when we're metabolizing food and breaking it down, our blood sugar levels will rise. The body's cells need to absorb that sugar. And in order to do that, they need to use this special, you can think of the picture that's there on the bottom, shows insulin as a key. And we need insulin in order to allow that sugar that we've just ingested to be used by the cell. And unfortunately, in the situation like patients that have type 2 diabetes, our body has potentially maybe that we've not produced enough insulin, or we've developed what's called insulin resistance. So when we test our blood sugar, the numbers are very high because it's not able to get into the cell and give that cell its energy and give it its sugar. So this disease process is very involved and much more complex than that little picture that I've shown you there on the bottom. But nevertheless, keeping our blood sugar numbers normal is very, very important. We see diabetic patients as they're moving through their care that they often will require potentially maybe procedures to the heart, maybe stents that need to be placed, and in extreme circumstances, open heart surgery. And we think that part of the inflammatory process of this disease is highly influenced by high levels of sugar. And we probably all know diabetic patients that have had serious complications, not only for the heart, but it can also damage your vision. So your eyes can be compromised, kidney function can also worsen. So as looking at this as a clinical picture, diabetes is an essential risk factor that has to be controlled. And it's even more important as you move into breast cancer treatment that we maintain normal sugar levels. And things that we can do to hopefully maintain a normal sugar level before medications are needed is eating well, which I promise we'll talk about in a little bit, moving more, being physically active, burning off that extra sugar that you may be consuming throughout the day, maintaining a normal weight, and of course, not smoking. Those are all the things that are listed there on the side for you. And again, this is blood sugar, unfortunately, is something that much like hypertension, you don't know that maybe you have high blood sugar until it gets tested. So it's important to talk to your care providers, have blood work done, have your glucose checked. You may also need a blood test called the hemoglobin A1C. This is a tool that's used, it's a blood test, and it's used to look back in time and see how your sugar has been over a 3-month period. So that's often a tool that's used by many providers to assess what your sugar control is, or assess how your diabetes control may be during that period of time. Okay, so now, very important topic, exercise. I cannot stress this enough to all of my patients, but specifically to my breast cancer patients. Being physically active is so, so important. And on this diagram next to my little patient there on his exercise bike, I've laid out some of the different types of exercise that you can do. What's considered to be sedentary behavior is sitting, reclining, lying, watching TV. This is not exercise, unfortunately. Light activity, so a light intensity exercise would be walking slowly, cooking and light housework. So just moving around the house, maybe doing laundry. If you're going up a flight of stairs, that definitely increases your activity level. But for the most part, most housework is considered to be light intensity activity. Something that's considered to be moderate intensity is a brisk walk. So if you were walking on a treadmill and you're familiar with this, you know the speed is about 2.4 to 4 miles an hour. If you're biking, you're traveling at about 5 to 9 miles per hour, which is pretty decent pace. Ballroom dancing, active yoga, and recreational swimming. So all of these things are excellent forms of physical activity. That level of moderate intensity is what we're looking for. Ideally, we'd like to see our patients doing that a few times a week. And then the highest level here is vigorous activity. So this is we're jogging, you're running, you're biking now at very high speed, over 10 miles an hour, playing tennis, swimming laps. This is a much more physically and cardiovascular demanding exercise. But the two that are highlighted in the green there are really what's recommended for us. And our American Heart Association recommends that we do about 150 minutes of exercise a week. So you could break that down into maybe about 22 minutes per day. If you want to work out 5 days a week, okay, you're doing 30 minutes. If you don't have time for that, let's do 45 minutes, maybe 3 or 4 times a week if we can. So exercise is, I'm going to show you on the next slide how it pertains to breast cancer, but for cardiovascular health, this is essential. Exercising regularly, if you can, daily is fantastic, but it's going to improve your blood pressure. It's going to help reduce that number. It's also going to help reduce your blood sugar. So if you're someone that has an abnormal A1C, or you've been diagnosed with pre-diabetes or even diabetes, exercise is so important for you. You have to be active every day. And for cholesterol as well, if you're exercising regularly, your body is, you're highly likely that you're making good food choices as well. If you're spending the time and you're investing in your exercise, hopefully you're also investing in the food that you're consuming. So exercise is really helping us across the board. But specifically for breast cancer, we are really learning a tremendous amount, the level of physical activity that is beneficial for you. So from the National Cancer Institute, we're seeing this last research study that I've pulled here for you on the screen. We're seeing that in 2016, there was a meta-analysis that was done, and it included a cohort of 38 cohort studies. And the most physically active women in this cohort had a 12 to 20% lower risk of breast cancer than those that were the least physically active. Physical activity has been associated with similar reductions in breast cancer among both premenopausal and postmenopausal women. And women who increase their physical activity after menopause also have a lower risk of breast cancer than women that do not. And then another study that was recently published in 2019, this was a different type of study. It was a meta-analysis that was done, but an observational study. The breast cancer survivors who were most physically active had a 42% lower risk of death from any cause and a 40% lower risk of death from breast cancer than those who were the least physically active, which when I read through this, I thought this was absolutely profound. We knew this already, going just I think that there's an understanding generally and that exercise is good for health. But I think these studies that are showing us that if you exercise, you'll improve your breast cancer treatment outcomes, I think is absolutely profound. And it's something that hopefully all of us can do at varying degrees. You certainly don't need to be doing vigorous exercise when you're first starting out. Walking every day is beneficial, even if you're not able to get outside with the cold weather that we've been having. If you can do exercises in your home. So this could be maybe doing some yoga. If you're unable to lay down flat on the floor, chair yoga could be something that you try. Even doing small walks in your apartment or your home. One of my patients uses the stairs in her apartment building for exercise, especially when the weather is cold. So it may take some creativity, but making sure you're active is so important, not only for the health of your heart, but it's also improving cancer treatment outcomes. So I think that, this is something that I'm personally passionate about, but I really try to convey the importance of exercise for our patients. And we see that research studies are showing us that it works and that it's lowering your risk, God forbid, of death from cardiovascular disease and from breast cancer. So extremely important. I hope that that you can get active and you could start this. It's never too late to start exercising. Okay, so now a very important topic, especially for prevention of cardiovascular disease and for breast cancer, is nutrition and dietary patterns. So ultimately at our prevention center, we recommend to patients a Mediterranean style diet. So on the pictures that you see in front of you, we have some of the components of a heart healthy diet. So this is trying your best to have fruits, vegetables, whole grains, and all different types of legumes. The middle column that you see there samples 4 different types of diets. So a vegetarian and vegan diet excludes some animal products, and of course a vegan diet excludes all animal products. The Mediterranean diet, which we'll touch more on in a couple of moments. The next diet that's listed there is DASH. So this is a diet that specifically focuses on low sodium. And the DASH diet is very impressive for reducing blood pressure for our patients. So if you are someone that has high blood pressure, please speak to your provider about enlisting help of a dietitian. We are lucky enough to have a wonderful dietitian at our prevention center. Her picture and name is listed up there on the top right-hand corner. Her name is Melissa Alizraki. She's been with us for a little over a year now, and she helps me tremendously in both the preventive cardiology clinic and just in for our general prevention patients in the office. She can help go through all of this in great detail and really make a dietary plan that's tailored to you and makes sense for you and is manageable for you. So she's a fantastic co-worker for all of us. And if you have the opportunity to use a dietitian, please, you can contact our office and see her. And also the other thing is that at the cancer center, you also have a full team at the Perlmutter Cancer Center. You have a full team of dietitians that are available to you there as well. So if you can't get down to the main hospital, up at PCC, you can see one of the amazing dietitians there. You just have to ask your oncologist to put in a referral for you, and you can see one of them. And last but not least, the foods that we need to limit and avoid are the foods that are high in salt, sugar, and fat, basically. So you can see that on the bottom. Red meat, specifically processed meats, we should be eating on very rare occasions, or if possible, not at all. Saturated fats, trans fats, sweets and refined carbohydrates, and sodium, once again, which is extremely important for blood pressure. Another thing that is important to remember is planning your portions, making sure that you're not eating too much of one of those food categories and you're really balancing your plate. You can see on that picture there that all of us should be striving to have half of our plate filled with vegetables, a quarter portion for your starch, and then the remaining quarter then for your protein source, whatever you should choose. But having proper portions and eating foods in moderation is extremely important. Like I said earlier, the Mediterranean diet, through the recent studies that have been done, has proven many times to be beneficial for patients that have cardiac disease. But it's, of course, as we have now looked at several times, the cardiovascular disease and breast cancer can often have some overlapping risk factors. So the Mediterranean diet is also beneficial, for patients that have breast cancer as well. And the next slide here is just to reiterate, hopefully you can see this a little bit larger, what the Mediterranean diet consists of. So that's fruits, vegetables, whole grains, all different types of legumes, and then getting your fats from very good fat sources like almonds, walnuts, and oily types of fish like trout and salmon. And of course, using olive oil in small amounts. And all of this is part of a healthy diet, and it's beneficial for hypertension, for cholesterol, and for diabetes. So it's good on all fronts. There was a research study that was done some years ago. It's called the PREDIMED study. And in that research study, it was found that there was a 30% relative risk reduction for heart attacks and strokes and with patients that followed a Mediterranean style diet. So it has won time and time again to be the best diet to follow. And I think a diet that parallels very closely, you can see the food groups are very similar, is the hypertension diet. So that's the DASH diet, making sure that you're not exceeding, if you're someone that has high blood pressure, making sure that you're not exceeding about 2,300 milligrams of sodium per day. If you're someone that really struggles with high blood pressure, your doctor and your care team may recommend that you reduce your sodium to less than about 1,500 milligrams per day. So it just depends on, where you are in your spectrum of blood pressure control and what your team recommends. But these two diets are fantastic and beneficial for our breast cancer patients as well. Okay. So now on this slide here, I would just like to just go back to knowing your numbers and really hopefully empowering all of you to look at these numbers maybe through a different lens at this point, I hope. I'd like everyone to hopefully know your diabetes number. So this is identified as your hemoglobin A1C, figuring out where you fall on the spectrum. So is your number normal? Are you pre-diabetic or are you type 2 diabetic? And what can you do to move that needle and to reduce the number? Blood pressure, like we discussed, all of us should have a blood pressure, hopefully, that's less than about 130 over 80. So it'd be ideal. Cholesterol, this is tailored to everyone's personal, everyone's health at the current time, but for primary prevention of heart disease, so preventing a first heart attack and stroke, all of us should have an LDL less than 100. If we already know that we have cardiovascular disease, so maybe you've had a heart attack or you've had a stroke in the past, you need an LDL cholesterol that's less than 70. And of course, one other thing that we've touched based on briefly is smoking. So any tobacco use is dangerous, not only for the health of your heart, but also as a cancer risk. So please try your best if you are a smoker, utilize resources that you have available to you. Within New York City, we have a New York State, we have a New York smoking cessation program at NYU. There's also a smoking cessation program that's available to you. If you need those services, please reach out to your doctor so they can place a referral for you. And the last thing that's listed on here is the tool. It's called a BMI, or a body mass index. So obesity and being overweight, as we've learned, can certainly affect our health. It can increase blood pressure, cholesterol, and may have, in certain situations, have higher blood sugar numbers than someone of a normal BMI. So it's essential that you are trying to manage weight and exercise levels to maintain a normal weight. And we know that if you lose a percentage of body mass, you're able to then really change the numbers that you may have. So you can reduce blood sugar, you can reduce blood pressure, and you can do this naturally with your own perseverance and diligence to eat well and exercise. Okay. So in summary, I just want to reiterate that early detection of heart disease is so important. Learning that you have hypertension or diabetes or high cholesterol is not something that is not manageable. It is. You can change these things. You can reduce pressure, reduce sugar with medications if you need them, or you can do them naturally if that is where you are in your clinical picture. But identification of these things is essential. And for many conditions, you do not know you have them unless you see your care team, unless you go to your primary care doctor and see your cardiologist regularly. So please make sure you're following up with your care team. And then we want to, our whole program was centered around the idea that if we treated these risk factors for our breast cancer patients early on, since we know that heart disease is the #1 killer of women, our whole mission and my mission is to help my patients identify their risk factors for cardiovascular disease as early as possible. That way, as we go through breast cancer treatment, the treatment that's given, depending on what type of breast cancer that we're treating, we're preserving the heart muscle function, we're helping the heart beat strong and effectively, we're managing blood pressure so that medications can be administered safely. And we're trying to manage these things right alongside the oncologist. Because what has happened in maybe previous years is that your oncology team, and even sometimes your primary care doctor, is of course laser focused on your cancer care. And we would like to offer our assistance in this space to be right up there with that team and managing your risk for cardiovascular disease right alongside the oncology team. That way, when you move into survivorship or your loved ones move into survivorship, your risk for heart disease is very low. And that way, in 20 years, 30 years post-survivorship, the things that unfortunately are the cause of death for the general population hopefully will not be something that our breast cancer patients deal with later in life. So with that, I'd like to thank everybody for listening in this evening. If you have questions for me, personal questions that maybe you don't want to ask now, please feel free to, you can email me. It's my NYU email. So this is Stephanie.Hopkins, HOPKINS @NYULangone.org. And of course, if you're interested in seeing one of our physicians, our dietitian, you can call that number that's there on the screen. That's our office number. And please don't hesitate, reach out to me. Hopefully I can help answer any questions that you guys have.
Stephanie, thank you so much. That was really a wonderful lecture. It was so informative and eye-opening, and we really appreciate you speaking tonight. And that was really just great information. Before we wrap up, we do have a few questions here. Does cancer itself increase the risk for heart disease?
So the short answer there is yes, and we are learning that that it does. There may be in the guidelines to come for cardiovascular disease. There may be some newer research that's showing us that it does. I think one of the unfortunate things is that a lot of our research studies for cardiovascular disease in the past years have excluded cancer patients. So we don't have all of the data just yet. We don't have all of the answers, but we are learning that the diagnosis of cancer itself can increase your risk for cardiovascular disease. And the other thing that's extremely important, like we've talked about this evening, is that some of your treatments that you may get as you're moving through your oncology treatment can cause cardiotoxicity and damage the heart. So your long-term prognosis can be changed slightly if those things happen to you. So hopefully in the years to come, we're going to have more information, more patients with breast cancer will be included in cardiovascular research studies so we can understand better. But the short answer is yes, it can.
Thanks, Stephanie. Next question here. Does blood pressure increase with age? Why is it higher in the morning?
A good question. Yeah, so unfortunately, yes, blood pressure can increase with age. There is our blood pressure follows think of it like a bell-shaped curve. Normally it should be lower in the evening for most patients and then rise throughout the day as you're moving and going about your day and maybe dealing with some stressors. And then hopefully it should start to reduce at night and then be lower when you're sleeping during an area, time of day when physical activity is extremely low. So if you're someone that's noticing that your blood pressure is high in the morning, this is certainly something that you have to speak to your doctor about. What can be done for you is maybe your doctor has you wear a 24-hour blood pressure cuff, which is very helpful. It lets us know how your pressure is during a full 24-hour day, which is really great information. And you may need to watch your salt. You may need to exercise more, and you may need medication if your care team feels that way. But certainly blood pressure high in the morning is abnormal. So yeah, definitely speak to your doctor about that.
Okay, Stephanie, how can listeners make an appointment with you?
So you can certainly make an appointment with me. Yes, my office phone number is the same as as the other doctors at the Prevention Center. So that phone number is listed right there. It is 212-263-0855. And you can call and ask to make an appointment with me. And our team will be more than happy to set you up with one.
Thank you, Stephanie. And I just want to repeat that number one more time in case anyone wanted to write it down. That is 212-263-0855. Let's see here. I think that's everything. The rest of the comments here are just saying how amazing you are, very informative, well organized, excellent session, and I completely agree with them. And I echo that. Stephanie, sincerely, thank you so much for coming tonight and speaking. It was very informative, and I would like to thank everyone for attending and have a great night. We'll see you next time.
Thanks so much. Bye-bye.
Bye.